we've got you for 3 o'clock then Monday to see Valerie for your Well Woman exam. Thank you for calling. Bye. Hey, how are you?
I'm good. How are
Welcome.
you?
Great,
Thank
thanks.
you. I was just kind of admiring your free coffee that you have. So
Oh, yeah,
I
you're
got a
welcome.
cup, but I just want to come in and just ask because I've heard a lot that you guys do preventative exams, and I'm not sure if I qualify for that or if I need one. So I was
Sure.
just coming in to ask real quick about those.
Yeah, so a lot of times people aren't aware that their insurance will pay for a wellness exam or a preventative exam. They're called different things. So I would definitely encourage you to call your health insurance company first and maybe check because you may be missing out on a benefit that's, where you can get some screenings and things that you really need.
Yeah.
We talk about lots of different things like based on your age, mammography, DEXA scans, colonoscopies. We'll talk about all that in the appointment. We'll talk about lab work, do a blood pressure check, vitals, because a lot of people have high blood pressure, may not even know it because they don't feel bad, so it's
Yeah.
definitely a screening we include. We also see patients of all ages, so do you have any children or anything?
I
who would
do.
also-
So you guys see children
Yeah.
here as well?
Yeah, actually starting at the age of newborn all the way up to geriatrics.
Oh, wow.
Yeah, so again, there are annual exams, preventative exams, very
Okay.
important to keep you healthy before a disease process starts so that you're
That's-
aware of things.
And that's what I believe in. I want to prevent something from happening before finding out 2 years later that I actually had something that I could have prevented or changed early on. So
Absolutely.
if you guys do that here,
Right.
I've also heard of like people get their cholesterol checked and their blood pressures, and I just kind of want to know where I'm at. So
Exactly. Yes.
okay, so I should call my insurance and just
Mhm.
make sure that they cover a preventative exam, basically,
Exactly.
right?
A lot of
Okay.
times it is yearly, and there are specific codes that are used for billing for those exams versus a different type of an office visit.
Okay.
So definitely use that wording with them and
Okay.
then see if that's a benefit that you have.
And so
Um,
if I had like an earache or a temperature that same day,
Yeah.
is there a difference? Like, can we talk about that, or should we just talk about the screening stuff?
Well, definitely if it's something acute, like an infection that needs to be addressed, we'll definitely address it that day. But if it's more like chronic things, this is mainly just going to
Yeah.
be talking about wellness.
Okay.
And hopefully we won't find anything, but then if you need to come back later for management of diabetes
Right.
or blood pressure or cholesterol levels, then those are done usually at follow-up appointments.
Okay,
So,
that's awesome.
yeah.
So I'll just go home and call my insurance, and then I'll
Yeah.
call you guys back at 665-7000, right?
Exactly, and we all
Okay.
3 providers, Valerie, Carrie, and myself, perform those, so
Okay.
whoever you're comfortable with.
Thank you so much. I'm so
Welcome.
grateful for your information.
You're welcome.
All
Thanks
right.
for coming.
Bye.
Bye.